Also, Democrats say they want to use a rule to pass health care that protects them from having to hold an on-the-record vote on that Senate bill. Can they do that? Is that constitutional? A fair and balanced debate next. Well, we've got some news today that Democrats are considering a controversial measure that would allow them to avoid a vote on the Senate's health care bill before it goes to President Obama for signature. Instead, the Democrats in the House could simply deem the bill passed. But is that constitutional? Here's a look at Article 1, Section 7 of the U.S. Constitution, which provides that, quote, every bill which shall have passed the House of Representatives and the Senate shall, before it becomes a law, be presented to the President of the United States. Section 5 provides that the yeas and nays of the members of either House on any question shall be entered on the journal. The reason for that is the founders wanted to provide accountability for those who vote on measures in the Houses of Congress. Well, Tucker Carlson is an editor for the Daily Caller and a Fox News contributor, and Bernard Whitman is a former Bill Clinton pollster. They're my guests now. All right, guys, so this is getting more and more buzz on Capitol Hill, and Nancy Pelosi said explicitly to a group of bloggers yesterday she likes it because it avoids basically a vote, an up or down vote on that Senate bill, which a lot of people don't like in the House. Tucker, if they do this in the House, if they manage to sort of pass the Senate bill without actually voting on it, what will be the fallout?
Well, they'll likely get health care enacted into law. It's appalling. I think the bill itself is appalling. I'd love to see a poll on what percentage of Americans have any clue what's actually in it. But it will likely work. And their calculation is that people will forget the sausage making. A year from now, 5 years from now, certainly 20 years from now, the headline will be health care reform passes. It's an entitlement. The country will become addicted to it. It will be popular over a generation or so. And it'll be a good thing in the end. That's their calculation, and it's disgusting, but it's probably right.
Bernard, you know, top Republicans are already apoplectic about this, coming out and saying this is so wrong. And yet the other side points out that, this is according to one top Democrat, that this originated with Republicans years ago, that the precedent for doing it began in 1933, and that it's been used many times for many things by both parties. And so what's the controversy here?
Well, that's true. But here's what I don't find appalling, and I can't understand why Tucker feels that eliminating denial of coverage for pre-existing conditions, why is that appalling? Ending the practice whereby sick people get dropped as soon as they...
Bernard, if you can stay on point, I'd appreciate it, because we don't want to get... We did...
But he talked about the benefits of the bill versus the process. The problem with this whole conversation is what's lost is the benefits that this bill is going to provide to hundreds of millions of Americans.
So the ends justify the means.
Well, here I would far prefer an up or down vote on the bill. And the truth is, look, the American people are pretty smart. They're going to know if someone votes for the bill or doesn't vote for the bill. So even if we use this deem passed, the Republicans are still going to use that vote against the Democrats. The Democrats are going to still say in the House that they voted for the provisions in the House bill. Everyone is going to be able to see right through this.
That's
so I think it's
Tucker.
a lot of conversation.
So how does that save the Democrats? I mean, it's not like Republicans running against the Democrats are going to say, oh, right, they didn't actually vote on it. They're going to say you voted for it, even if they do it through this new measure.
Then what's the point of doing it in the first place? I mean, the truth is, look, this is an ends justifying the means argument. If the public supported this legislation, it would have been the law by Halloween, which was originally the plan. The holdup has been over public opinion, particularly public opinion in the districts represented by moderate Democrats. Their constituents hate this legislation. That's the problem, and they're forcing it through anyway with pure. I mean, look, that's not one right-winger's opinion. That's a fact. Okay, the polls bear that out. Period.
I would beg to differ. What the polls show very clearly is the American people are evenly divided on this piece of legislation.
Really?
I believe,
what polls?
and it's very clear.
What polls are you referring to?
Look at all the polls. All the polls show an even split between people that are in favor of the bill versus people who are against.
No,
if you look at some of the fundamental...
Let me just stop you, because that's not true. Trust me, we've been following the polling carefully. I handled exit polling for Fox during the elections. I follow the polls. The latest Rasmussen Reports poll shows that the people are against the bill, and the RealClearPolitics.com average of all the polls shows that, now you can get into the piecemeal thing, I'm with you on that, but when it comes to the overall bill, still the majority is against it.
It's not a majority. It's maybe 49-44. That's within the margin of
Just
error.
cite the poll to me, and then we'll go from there. I just want to know what you're referring to, because I'm not familiar with that poll.
But let me explain. The reason why support for the bill has declined over the last few months is not because the provisions of the poll have changed. The fundamental benefits that will be provided to the American people remain exactly the same, and majorities support that. What they don't support is all of the focus on the process and endless politicking behind it. So the reason why we've seen a slide in support is because this conversation has gone on too long. We've got to bring it to an end. We have to have a vote on the bill, and ultimately the American people, I believe, will be very happy when they actually see the benefits that are provided by the legislation.
Does he raise a point that it's the process that the people didn't like and not the actual bill?
I'm impressed. I like Bernard. I'm impressed he would say something like that out loud. Message: voters are inconvenient and stupid, and once they actually get the legislation that we know as smart people is good for them, they will be grateful. The masses will be grateful for this. The truth is, the process matters. Democracy matters. If the public doesn't support something, pause, take a deep breath, think about why they don't support it. Don't just assume they're dumb, which is the assumption of the supporters of this bill.
No,
what you just said. They don't understand.
True.
Maybe they do understand, and maybe they don't like it.
They want pre-existing conditions dropped. They don't want to be dropped if they get sick. They want small businesses to get tax benefits to buy insurance, and they want prescription drug prices to go down. It's the focus on back and forth in the political maneuvering that has turned so many people off, and we've seen a slide in support for the bill. I think that we should have pushed this bill in the fall, and I agree, Tucker, we could have gotten it done before Halloween if that had been the case.
Well, I don't think that we have resolved the issue of whether it's constitutional or not, which is how I set up the segment, but maybe you guys have to go back to law school, and I got to go study up on it, too, before we can get to that, or we'll do it tomorrow. In any event, it's interesting to hear it fleshed out. Good points on both sides. Tucker and Bernard, thanks so much for being here.
Thanks, Megan.
Thanks.